Hi friends! So, welcome back to my channel. So one of the things that occupational therapists do day to day is we work with what are known as participation barriers or performance barriers. And these are the things that stop us from being able to live out our lives in the best and most meaningful way possible. So, in a typical day, an occupational therapist can see an elderly adult who is at risk of falling, and we can provide education and strategies and modify their environment to make sure that they can be safe and independent at home. We also work with adults with mental health issues, adults with, intellectual disabilities or traumatic brain injuries, and we work with their carers as well to make sure that they're well supported to do all the things that make their lives meaningful, like could be shopping, it could be holding down a job, it could be interacting with their friends and family. And one of the biggest areas in which I've worked more in is working with children. So in a typical day, I will see many children with autism, difficulties with social skills and play skills, sensory processing difficulties, children with poor handwriting. And I guess one of the biggest things that I do in my role is to empower you. It's so important because as a therapist, I see my clients for an hour a week, but their home environment and their daycare and school environment makes such a big difference. So my aim in this channel is to empower you and make sure that you have strategies and tips and all the things that you feel like you need to be able to be a good parent, a good carer, someone that can support their children well as well. So if you have had any concerns as well, so refer my child for an occupational therapy assessment. That's a really good question. So I would suggest that if you have any concerns about where your child is at, definitely speak to your pediatrician who can, chat to you a bit more about whether or not to make that referral for an OT assessment. I guess if you've got any concerns about your child's play skills, about their turn taking, their sharing, about tantrums, emotional regulation, and their behavior, we can definitely help. If you've noticed that your child has really poor handwriting and their fine motor strength is, the finger strength is quite poor, then definitely come see us. If you've noticed that your child is just struggling to make friends at school, struggling to concentrate, come see us. If your child is having really lots of difficulties with toilet training, if your child's a very picky eater, if your child, gets really nervous sometimes or has difficulties with all these things in their life, come see us. And the great thing about occupational therapists is that we work really broadly and we work with so many different types of people. And so we are definitely very well equipped to help you. So if you're in doubt, definitely go see an occupational therapist. If you're in doubt, go get help, go see an occupational therapist, chat to your pediatrician, chat to your GP, and the support is out there for you.